Josh is a 6'3", 350-pound injured veteran. He has a fractured pelvis. He has a pneumothorax. He's been in the ICU for 8 days. He has been sedated. They have tried multiple times to wake him up. He's come out of his sedation agitated and thrashing and trying to pull his tube out. So they have resedated him many times. EarlyMobility.com is a company that helps wake the patients up in ICU, get them mobilizing, avoiding ICU delirium, avoiding ICU-acquired weakness, and then following the veteran downstream or across the continuum of care so that we avoid hospital-acquired deconditioning and we preserve not just the veteran's life. It is about saving their life, but it's also about saving the life that they have left to live. So we want to preserve their function to the greatest degree possible. So best practice in the ICU is waking the patient up right away after intubation to avoid these problems. Josh here has not had that luxury, but today we know better. Yesterday we did the best we could with the knowledge we had. Today we know better. The evidence is overwhelming. So we're going to show you a range of solutions that we have here. EarlyMobility.com is a company that helps implement the program. We're going to come in and do the education, the auditing, the program implementation, help make sure you get your outcomes. But the tools that you see here, the technologies that you see here, these are how we mobilize the patients safely for us and safely for them. We do not have the ability to show you every tool that these companies have, so we're showing you a little bit from each company. We would like you to scan the QR code that takes you to the links of all the companies so that you can see the full range of products that each has. But what we love about the companies we're going to share with you here is that they are committed to the outcomes for our veterans, the outcomes for our patients, and all working together for the common mission of saving lives through mobility and preserving the functional quality of life that we can for the veteran. So we're going to start today waking Josh up. We're going to start the process today, even while Josh is still sedated, to show you how we can roll him, turn him, reposition him without the nurses hurting their backs. So the sling we're using here is Alpha Modalities. It is a antimicrobial, moisture-wicking, breathable sling. It can be left under the patient, so it replaces their sheet. And my vision is that every ICU bed be made up with these slings. This saves time for the nurses, and then the sheet is there ready for them when they need to move the patient. It also has elasticated corners so that it doesn't wrinkle up on the mattress. And the other thing that's nice about the Alpha Modality sling, the hooks for the lift are elastic so they don't trail on the floor. We're going to also be using that with the Savaria M3 ceiling lift. It has a medical grade 3 scale on it, so it is useful for titrating medicine. And the scale is in line with a hanger bar, which also gives you more vertical height for working with the patient. The other thing that we love about the Savaria M3 ceiling lift is some of the other lifts, if there is a malfunction of the technology, you have to get a ladder and get up on top of the lift. What they have done is integrated the emergency stop into a very easy pull that then I can press here and it overrides the motor. So if there is any mechanical fault with the motor itself, we've got the override in an easy to grab position, and then just by popping it right back up, it goes back to the motor position. So that is, again, a really nice feature in terms of saving nurses time, improving the safety, and this also has a lithium-ion battery which has 150 uses per charge. So that gives you more utilization of this thing. We're going to show it to you turning the patient passively because he is still in a coma. And this is what we call passive mobility, and it is when the patient cannot move themselves or should not move themselves. Go ahead, Susan, and lift them up. So if he is in a coma and he is unable to move at all, we still have to preserve the skin on his bottom. We still have to move the secretions in his lungs. So this enables us to do that safely for us, safely for him. All right, let's bring it back. That's good. And then we can just prop the pillow and we're good to go. We're now going to wake Josh up, and previously he's been thrashing and trying to self-extubate. So the way to keep him and us safe is HD Medical's refraints that we have on Josh here. You'll notice that his arm is contained, his hand is contained in this little plastic housing. He has a little thing to squeeze here, his little therapete. It's got feed for all the lines. To organize your lines, this is the IV tubing, and it can hold up to 9 tubes in here. It could also hold the nurse call to organize your lines. The strap around his wrist is self-adjusting, so if his hands get swollen, then he's not going to get constriction around his wrist. So the other thing with the refraints, these are called refraints, they are not a restraint when you can move them freely. On this side, you'll notice it is refrained. There are 2 different levels. There's a rigid strap that you can restrict the amount of movement he has. That is considered the blue one is considered a refraint. But we can take that off. Go ahead and take it off, Susan. And then the elastic white band actually can act as an exercise resistance band. Now, right now, Josh is still asleep. We'll see that when he wakes up. But this allows us to titrate mobility or refraint level according to the safety of the patient. And it keeps us safe as well. So we're going to switch off the sedation. We're waking Josh up. All right, we're waiting for him to wake up. All right, Susan, we have handles here that enable us to hold on. Hi, Josh. I know. Hi. Good morning. Good morning. I know. I've got a hold of your arm here, Josh, because you've got a tube in your throat that's helping you breathe. Okay? Take a minute. I know it feels like you're breathing through a straw. We're here with you. We're going to help you wake up today and get moving. Okay? These are on your arms to keep you safe because the drive to pull out that tube is really strong. So we're going to be here helping you. You can squeeze this little guy in your hands, right? We might be able to loosen this up later, but we can allow him here to move his arms. You can scratch your nose if you're an MSG, yes? Go ahead and scratch your nose. Good. We can allow him to move without self-extubating, without pulling out his lines. We're going to use mobility to wake him up, clear any delirium, and get him moving again. So our goal is to not resedate, because we know that every drop of sedative can prolong his recovery and impair his ability to go home. So now he's better. We're going to take the refraints off. He's oriented, and we're going to start moving him. We can use the refraints either in bed or sitting up or in a chair. When you do not have the blue strap on, these are not considered a restraint. So you do not have to document that the patient is restrained. So now we're getting ready to get him up. I want to talk for a moment about the bed. This is the Umano All Bed, and it is in its narrowest form right now, which allows me to get really close to the patient. But remember, this patient is 350 pounds. A lot of times the narrow beds are too narrow for them to turn and roll. We're going to show how this expands all the way to 48 inches, and not just the frame, but the mattress as well. The other thing we like about this bed is that it will go all the way low to the frame will go 10 inches above the deck, and it has the highest clearance underneath it, even in its low position, for the mobile floor lifts. Also, as we're doing early mobility programs, one of the key elements of our implementation is accountability. We need objective metrics to show us how much the patient is in bed, how much they're out of bed. Nurses are busy, therapists are busy. The more we can gather data from the products we're already using, the better. So we love that this bed will track in bed time and out of bed time. So before we go and sit Josh up, we're going to actually show you how this bed expands. It's going to take a few minutes, but you'll see the mattress expanding into the frame. You don't have to get extra bolsters, you don't have to get an extra bed. This bed will do both. So Jay, if you can come in please and so you'll see here Jay widened the frame and then he opened the valve on the mattress and you'll see the mattress filling up as well. The bed is an adjustable height, so you don't need to get extra low beds, extra high beds. This truly is an all bed. It does all of the things we want it to do. So now we're going to, Josh is awake. He is no longer delirious. Are you ready to get up and moving? Because he's been in ICU, he's been sedated for 8 days. He is incredibly weak. It is unfortunate. We wish he had not been sedated this long, but it's now time to get him up. Traditionally, to try and lift him manually, increased risk of injury for the nurses and for Josh. So we're going to use the Savaria spacer sling. Go ahead and just roll this way just a little bit, Josh. Right, bend your knees. Okay. I want you to bring your own legs around the side of the bed, Josh. There you go. Round you come. Okay, come to the edge. All right. Bring you down. In one piece, you can use a combination of technologies. Patron is a company that has single patient use slide sheets. They're basically slippery sheets that make everything easier in the bed. All right, I'm going to grab this from you. Thank you. We're going to raise you up a little bit and put that underneath your bottom. So now, even with the risk of skin injury, I can have Josh do some exercises. Josh, I want you to bring your legs up onto bed for me. Yep, up you come. Good. You're right there. I want you to scoot your bottom, lift them a little bit more up, Susan, give them a bit more support. There you go. Over you go towards Susan. Good. Good. Oh, Josh, I changed my mind. Come on back towards me. There you go. Go ahead and reposition yourself, Josh. Push yourself up in bed. Push yourself up in bed. Push up a little bit. So basically, even in a sling, I can have him be working here. This strengthens his muscles. All right, let's lower this down again, and now we're going to look at getting out of bed. So, Josh, now we've been able to work with him in sitting. We've been able to use the seated sling to strengthen his legs, to strengthen his core, and we're using, across the continuum of care, we're using the VA MSST. This is a common language for all areas of care, for all veterans in every setting. And so we can use the appropriate equipment according to the VA Mobility Screening and Solutions Tool, or VA MSST. So as we sit Josh up, he's already doing the first part of the screen. The reason it's called a screen, and it's been validated in the VA for licensed and unlicensed staff, is it gives us a language across RNs, LPNs, CNAs, medical technicians, providers, radiology techs, PT, OT, every caregiver, that we all are talking the same language about mobility. So Josh, the first question, can you sit up and shake my hand? Yes. Sit yourself up. We've strengthened him with the prior technologies. He's able to sit at the edge of the bed. You can shake my hand. Small note, you can see how wide the bed is now. It's fully filled this space, and it's now at its 48-inch width. The next step is, can Josh stand up without help? We've strengthened his legs. Can you stretch and point for me, Josh? Point your toes. Do this one. Yes, he can. Can he stand? He's a little bit weak to stand. So go ahead and try and stand. If you're a little bit weak, can you come up? And then you come back down. So he's a little bit weak. This would make him a 3P in the MSST. I'm going to bring in the portable parallel bar. So this is now looking at how does therapy interact with this. A lot of what we did in the bed can be therapy or nursing. This is more of a therapy tool. We're now looking at the Wearology parallel bars, portable bars. What I love about these, it's very easy. I can get them in and out of any elevator. They're easy to move with one hand. It's less than 1 minute to set them up. I can take them into any room of the hospital where my patient is if they cannot come down to the gym. So it gives me the ability to have good, solid therapy anywhere in the hospital. All right. Up, pull them out. And then this one. Okay. And then this is up. Okay, and that fast we have parallel bars. So Josh, you're going to come up. We can also come in and out of here. If we want them wider, we can come wider or narrower as well. All right, Josh, you're going to pull up here. Ready? Come on up. All right, good. Come on over. And so now, as far as therapy, I may have a gait belt on them as well. But I've got my parallel bars at bedside anywhere I want. I can turn to the side, have him do marching, stepping, all kinds of exercises, turn to face the bed, lift your leg, do knee lifts on this side 20 times. Right, we can really do any exercises that we would be doing down in the gym right in the parallel bars by his bedside. So now let's head back to bed again. Back to the bed. No, reach back to the bed. There you go. And sit yourself down. We're now going to pick up Josh in the med-surg side. He no longer needs ICU care. What you'll notice here with the all-bed, the Umano bed again, is that we've been able to make it narrow. What's great about that is for getting through doorways, the bariatric bed, a lot of them, if they don't go narrow enough, you have to get an extra bed. You have to do a transfer to get them from ICU to med-surg or to radiology or wherever they need to go. With this, we can condense it to the 35 inches, get through the doorways, and then re-expand it at the other end. Right now it's in its narrow mode. We're going to work on gait. We've done a little bit of gait bedside, but how does a nurse walk a patient? We're going to pull in, this is the Inspire Outcomes mobility harness. It is one size fits all. You can use this sling all the way in the pediatric size, all the way up to 400 pounds with one sling, or you can put two together and it'll lift up to 750 pounds. So this is your go-to mobility harness. It will work with every loop style lift, so you don't need a bunch of different slings. It's wipeable and it can be laundered. We're going to use this in combination with the Arjo MaxiMove, and this is the brand new MaxiMove, which we are loving. The features that I am really happy about, it's got a low base, it's got small casters. Normally small casters are a challenge because of the push-pull forces, but the MaxiMove 5 has a power assist where just touch of a hand with the small casters, they've overcome the problem of the push-pull forces. The other thing that's nice about this is my emergency stop is right here. Again, just like we were talking with the other lift, some of the older models you had to go up top. This makes it super easy if there's a problem. And again, when nurses are busy, we need this technology to be easy to use for them. So we really like that feature. The other thing that is a big improvement that we love about this is where the brakes are. In a lot of these lifts, we're trying under here to find the brakes. This new model has the brakes right up here, so easy to use. So we've got the 2-point hanger bar on it. This lift also has a dynamic positioning system that can move the patient that is unable to move themselves back and forward in a seated position to a laying position. We want Josh to move, we want him to walk, so we want him in the 2-point because we're using a gait or walking harness. All right, Josh, I want you to take the purple strap on your right side and put it onto the lift above you. It's going to be out just a little. Can you reach it there? The Inspire Outcomes Mobility Coach Pro is fully adjustable in every slot, so the shoulder straps adjust, the leg straps adjust, everything adjusts so that you can fit it to the right size of patient. You ready? I want you to work with me, Josh, to try and stand up. This can be your VA MSST patients level 2, 3P, even your 3Ns. He's weak, all right? You notice that I wasn't expecting it.
I was going to fake it and then you did it. So I was like, oh,
okay, all right. You'll notice when Josh lost his balance there, he didn't fall. The sling caught it. And that's the whole point. Patients that are high risk for falling are typically left in bed. But once we have this technology, we can safely mobilize them. All right, let's go for a walk. Go ahead and fall. He's safe. He's not going to fall. This is not a fall per NDNQI. So he is safe. I'm safe. I have not done any lifting, and I can take him for a walk now. The difference between the ceiling lift and the mobile floor-based lift, ceiling lifts, you don't have to manage the lift, you don't have to manage the base, but you can only move the patient under where the ceiling lift is. The advantage of the mobile floor-based lifts is you can go anywhere in the hospital that you want. And if you're doing fall recovery, let's say a patient falls in the cafeteria, this can go anywhere and it will go low enough to the ground to pick them up if they have a fall. All right. What we're going to do now, Josh, you're in inpatient rehabilitation. We need to help you walk further, walk a little bit faster. We still need support with your walking.
I want to go home.
You want to go home? I know you do. All right, let's get you home. This is the Light Run air-supported mobility device. It's going to use air to elevate Josh with the exosuit, and we can use variable support at the push of a button. So Josh, what we're going to do is we're going to raise you up. I'm going to start this, and we're going to give you a little bit of a boost. You're going to feel the boost. Go ahead and hold on here. All right.
You're taking 80 pounds off.
Okay. So we're going to offload 80 pounds here. All right. This is going to give you a little bit of a help. Ready? It's going to give you a little bit of a boost here. Ready? Go ahead and pull yourself up. There you go. Good. And you'll notice this comes up and down to support the patient where he needs to be. The legs can go in or out. All right. If we need to be narrow, we can go narrow. If we want to give him plenty room to walk, we can be wider. We're going to bring these down so that he can have support on his arms. Good. We can adjust where they are to get them just right. How's that for height, Josh? He could hold on here if he needs more upper body support. We're going to give him body support here. Good on both sides. Does this need to come up a little bit? No? All right. Ready? Let's go. We can bring him forward from the front, or we can bring him from the back. He is safe here already. Stop there for a second. It's going to catch him if he falls, so go ahead and fall. All right, that's as far as it goes. Stand up again. And if I want to do extra support, I'm going to bring these around here. And that way, if I need more support, he's good here. All right, Josh, ready? Now if you fall, it's going to give you even more support. Go ahead and try and fall. And you see it gives him even more support. Off again. All right, ready? Let's go. Let's go. I can be narrow or I can be wide. All right? Take a little rest, Josh. You just need to sit for a bit. All right. Let's bring you around and we'll bring you back to sitting down. So again, multiple devices that we can use to achieve our